I'm Erin Mitchell, Associate State Director for AARP New York. Thank you for joining us today for a very important and we hope enlightening conversation with Congressman Michael Arcuri about how we can improve health care for you and your families and all Americans. We know that health care costs are a concern for you and so many of your family members and friends. People on Medicare spend 30% of their incomes on out-of-pocket health costs. 28% of uninsured people aged 50 to 64 are denied health insurance because of pre-existing condition. Our current healthcare system costs too much, wastes too much, makes too many mistakes, and returns too little value for our money. Today, we're going to discuss ways to lower healthcare costs, improve quality of care, and ensure that all Americans have affordable healthcare choices, regardless of age or pre-existing condition. AARP recently launched a campaign called Health Action Now. While we know there are many who think our current economic crisis means we can't afford to fix health care, we say we can't afford not to. We look forward to hearing your questions, so press *3 on your telephone keypad if you have a question. Although we won't be able to get to all of your questions, at the end of this call, everyone will have a chance to leave their question or comment on a voicemail message. So please press *3 to submit your question. We'd like to do a survey on how you feel about healthcare issues. Press 1 for yes, press 2 for no. Have you or your family member ever delayed health care to save money? Please press 1 for yes, press 2 for no. I'm Erin Mitchell, Associate State Director for AARP New York. Welcome, Congressman Arcuri. Thank you for being here today to share your thoughts on healthcare reform.
Good morning, Erin, and thank you very much for being here. And I want to thank AARP for hosting this and offering to do it on this very important issue, healthcare reform. The best part of my job really is interacting with my constituents and learning how to best serve you as a representative in Congress. We are fortunate to be able to use a teletown hall, which I have to admit to all of you, this is my first teletown hall. But we can use it to speak about issues, and the one issue in particular that's on the top of all of our minds, certainly in here in Congress, is reforming our nation's healthcare system. To say that reforming America's broken healthcare system is a priority, for me, is a major understatement. It is not just a priority, it's a necessity to my way of thinking as your congressman. All that said, this forum isn't just an opportunity for me to do all of the talking. We're here really to interact and create a dialogue about healthcare and what comprehensive healthcare reform means to you. So I'll turn it back over to Erin to begin the question and answer portion, and I look forward to hearing from all of you. I'll make sure that even though we have a limited amount of time, we answer as many of your questions as we can. And please remember that you can always call my office if you have any additional questions or comments or concerns. Those are very, very important to us. And again, the number is 202-225-3665, 202-225-3665, or 315-793-8146. So with that, Erin, we're ready to go, and let's get started.
Thank you, Congressman Arcuri. That was very, very educational for us. I just wanted to remind everybody that I'm Erin Mitchell, Associate State Director with AARP New York. And if you would like to ask the Congressman a question, please hit *3 on your keypad. I just want to get back quickly to a poll that we did on healthcare reform. We asked, have you or your family members ever delayed healthcare to save money? And 41% of folks on today's call said yes, that they have delayed healthcare to save their money. Now let's go to our questions for the Congressman. Congressman Arcuri, today, nearly 20% on people on Medicare who leave the hospital end up going back into the hospital after 30 days. We could reduce preventable, costly hospital readmissions by providing a follow-up benefit in Medicare that will help individuals safely transition after a hospital stay, saving them and Medicare money in the process. Congressman, Do you support adding a transitional benefit to Medicare to help people transition home after a hospital stay?
Very good question. Yes, absolutely. I think preventing unnecessary hospital readmission, it's not only important for the health and safety of the beneficiaries, that is the person who was in the hospital, but it reduced the cost of the Medicare program, helping to keep it solvent, which is, of course, one of the issues that we always have to look at, and that is the cost. But keeping people out of the hospital should be a goal, not because of the cost, but because it's a benefit to the patient. And I had a really good meeting last week with a group of people who receive home care. And it's interesting what they talk about. They talk about the fact that not only is it easier on family members when people obviously are at home being cared for rather than in the hospital, but you hear, today with the infections that go, that are going around in hospitals and in the difficulty, if we can treat people or keep them at home or treat them at home, I think we are much better off. It's not only cheaper, but I think it's becoming a better option for individuals that have family members at home that can help care for them. So yes, I absolutely and strongly support a transitional benefit to Medicare to keep people home after hospital stays.
Thank you, Congressman. It's time for another one of our healthcare reform polls. I'd like to ask everyone that's been joining us, if you have health insurance, are you afraid of losing it? Once again, the question is, if you have health insurance, are you afraid of losing it? Please press 1 for yes, press 2 for no. And we'll get back to the poll results in just a moment. Okay, now we're going to Helen from Wiselyville. Hi, Helen. Are you on the line?
Yes, I am, Eric.
And do you have a question for Congressman Arcuri?
Yes, right now we have Medicare, and through my husband's employment, we have a secondary. We're both in our 70s, and we're diabetics with a bunch of other problems, high blood pressure and cholesterol and all. And I'm very concerned, should we lose the secondary insurance, which provides us with drug coverage, and we pay a minimum co-payment, $5 to up to $65 for medicine, and that costs us about $2,000 a year with all the medication.
I'm sorry, we lost Helen, Congressman.
All right. Well, let me just say this, and Helen, I hope you can hear from the part of your question that I heard. What is absolutely and critically important to me, and one of my top priorities, is to ensure that people that have plans that they are happy with do not lose those plans. And again, in case you question my sincerity on that, my mother constantly tells me exactly that. She is very happy with the plan that she has and does not want that to change. And clearly, I understand that point. And what we are going to try to do with this plan is to get insurance for people that don't have insurance and to keep stable and under control the increasing cost of health care benefits to the country. And there's a number of different ways to do that. Part of that is with respect to creating incentives for types of programs like we see at the Bassett Hospital or at the Mayo Clinic. The Bassett Hospital obviously is in our Congressional District, and it has a good program for keeping costs down for facilities. That is, to my way of thinking, the most important thing, to create that stability and ensure that we do things like fix the donut hole in the Medicare Part D, that we ensure that all Americans have coverage, but that coverage is reasonable and that individuals can continue to use the doctor that they are comfortable with. So I hope that answered your question, Helen, and I'm sorry that we were cut off.
Congressman, I'd just like to thank the 4,500 constituents that are on the phone right now. And I'd like to get back to our second poll question. If you have health insurance, are you afraid of losing it? 44% of the folks on today's call said yes. Once again, if you do have a question for the Congressman, please press *3, and hopefully your question will get through. And
Karen,
my name is, yep.
Can I make one more point? And again, I think it sort of goes to the poll number that you just took. I hear a lot of people in our district talk about the Medicare Advantage that they have and that they're happy with. clearly that's something that's important to us. Again, if you have a plan that you're happy with and it works for you, we need to make sure that you could continue to use that plan. But what we do want to make sure is that it continues to be, cost efficient for you to continue using, and the costs don't go through the roof.